If you've dealt with years of discomfort from knee pain, you know how bothersome it can be and the daily negative effects that come with it. Now there are clinical trials available to evaluate new pain medications, and you may be able to take part in one of them. Here with more on these clinical trials, Dr. David Lehman, president of HD Research. And first, we need to point out that these trials, there is no cost to the patients, correct?
Correct.
So how does it work and who's eligible?
So we're doing total knee studies. And in these trials, we're studying the pain after surgery from total knee. So people who qualify would be people who are ready to have their total knee. To qualify, they would come in and we would evaluate them to make sure they're a good candidate.
Okay, gotcha. And when we talk about the inconveniences, Dr. Lehman, of daily life, I mean, for people who are living in chronic pain and their mobility is really affected, this is kind of a life-changing thing potentially for them.
It is life-changing. The total knee procedure is done to resurface the knee and take the pain away, take what's causing the pain out and put a new surface in. And so these patients can now actually get out and live their life again, walk and be functional.
What if someone out there is saying that, why would I take part in a clinical trial? I mean, what really is the benefit for someone to take the step to do this?
Okay, so there's lots of benefits to these trials. One in particular, the study grants are covering the cost of surgery for these patients.
Wow.
So patients are coming in and having a total knee replacement at no cost. On top of that, their time for participating in the trial is covered as far as payment. They are paid for their time.
You're compensated for your time.
Exactly. Okay. So their time is covered if they're missing work, whatever it is, for when they come to visit us. As well as really the biggest thing is they're helping us all out. Everyone who participates in the study helps the future of everyone else who has pain after surgery and really is contributing to society. And it's a really huge thing to do for all of us.
Yeah, you're leaving your mark and making a difference. Are you looking for participants all over the greater Houston area?
Yeah, people come in, people actually even fly in to see us sometimes, but predominantly in the greater Houston area is what we service here in Houston. But we have locations in Dallas, Los Angeles, San Antonio, so there's a wide range of places people can go.
And if someone comes in and they take part in one of these trials, they're going to be dealing with experts from start to finish. This is by no means an experiment.
No, so the actual surgical component of these studies is not an experiment. The surgical component is a standard of care surgery. What we're studying is if we give another medication on top of what we normally give, can we help bring the pain down even more than we did before?
Alleviate some stress.
Exactly.
Is there an age requirement for this?
Typically, someone over the age of 18 to whatever age, but usually people who have total knees are usually some are 50 plus.
It is incredible, too, that you are seeing young people who require a knee replacement. A lot of competitive athletes go through this.
It's not as common. Majority are a little bit older.
Okay. Let's talk a little bit about the longevity. I mean, what happens after the study, and how long would patients be coming in and checking into a facility?
Sure. So typically, you'd come in day of surgery, and then we'd house you as a patient, depending on the study that we're running, from a few days to even up to a week. But most of the time, it's just a few days. And then we'll continue the care as normally would be taking care of a patient with physical therapy and everything else you would have all the way through to see that patient to their, their finality, so to speak.
And what are you seeing with patients who are currently participating in this study? Are you seeing a positive benefit on the back end?
So yeah, I mean the surgical side of things, we have the top surgeons in Houston working with us, so the results are excellent. As far as the pain measurements, when we look at the data, and I've been doing this for 10 years, there's clear evidence that what we're doing is making a difference.
That's fantastic. Well, Dr. David Lehman, thank you so much for your time.
Absolutely.
People are compensated for their time. Potentially they get surgery at no cost. It really sounds great. Thanks so much.
No, thank you.
And for more information or to see if you qualify for this research study, visit kneeresearchstudy.com or call 281-957-3070. Now let's send things back over to Courtney. Hi, Courtney.